Count on 2 investigation.
Over the past week, we have received several questions, even complaints about testing for the coronavirus. Viewers telling us they can't get their hands on them despite symptoms and travel history. Count on 2 investigator Sophia DeSassore hears from a possible case and a doctor from Trident Medical to find out why the tests are hard to get and what this means for the health of our state.
Personal accounts straight to our inbox. One woman with symptoms and travel history telling us she called all 3 major hospital systems and her primary care doctor only to be turned away. Finally, she says she was tested. The result negative, but she says doctors told her it was likely false negative because the test was done wrong.
He said, "Did she hold the swab in your nose for 10 seconds?" And I said it probably was less than 2 seconds. She went in, she went out.
Their stories creating confusion since government leaders have repeatedly said there are enough tests.
We'll have the ability to do in the millions over a very, very quick period of time.
But recommendations on who gets tests are still in place. DHEC's latest advisory saying, quote, clinicians must carefully consider which patients they choose to test as demand may outpace supply, end quote. Dr. Kenneth Perry with Trident Medical System says as of Friday, it wasn't up to healthcare providers to decide who qualified for a test. It was up to the state, and all tests had to be sent to DHEC in Columbia.
If you come to the emergency department and you have really concerning symptoms, lower respiratory infection, fever, then we will discuss the case with DHEC.
But over the weekend, the federal government and DHEC agreed to allow private labs to test, meaning more capacity.
So the more places we can have doing those tests, the more likely we are to get that result in a more timely fashion.
Dr. Perry says he expects those recommendations and restrictions to continue changing for the better.
I think they'll loosen even further from where we are out over this weekend. What we are hoping to get is that if you can ramp up the ability to do the test, we're going to be able to get people tested so we know who has it.
DHEC's latest priority list for testing includes hospitalized patients, older adults with chronic medical conditions, and healthcare personnel who have had close contact with suspected or confirmed COVID-19 cases. Reporting in studio, Sophia DeSassore, Count on 2.